And good morning, everyone. Thank you so much for joining us for this Monday's COVID-19 press briefing. Today, Orange County Mayor Jerry O. Demings will discuss our goals for the week. It's important to have some direction as we begin a new week. The mayor will update us on where we stand on vaccinations and testing community-wide, and there is some good news on the I Got My Shot vaccination trailer. The mayor will also present information on emergency rental assistance and redistricting, two important issues for our community. And Dr. Raul Pino from the Florida Department of Health in Orange County is here and will report on important data, COVID-19 trending information here in our area. We begin with Mayor Demings. Mayor?
All right, thank you, Dr. Williamson. Good morning to all of you. I hope you had a great weekend, a safe weekend, a weekend in which you remain well. This morning, I'm going to start with a bit of a news flash for all of you who are here today. In our zeal to be as transparent as we possibly can as we continue to fight to keep our community safe, I want to begin by talking about some communication that I received from Tallahassee. Friday evening, a letter was sent from the Florida Department of Health informing me that as Orange County Mayor, I am prohibited from requiring documentation from employees that have been vaccinated. Their claim in the letter is that the mandate is in violation of a statute signed by the governor earlier this year. Actually, the letter, as erroneous as it is, says that I also will tell you that we are on firm legal ground with this vaccine mandate that we have put in place. As I reported to you on Thursday, no employee will be terminated for not getting vaccinated. I believe the law cited by Doug Woodleaf of the Florida Department of Health is arbitrary, capricious, overbroad, and dangerously inhibits local governments from protecting its citizens. I want Orange County residents to know that I will continue to fight to protect them during this pandemic, just as I have done so to keep people safe for the last 40 years. Our legal team, headed by Orange County Attorney Jeff Newton, is reviewing the letter and will be responding this week. Attorney Newton is here for this press briefing today. We will be providing copies to you of this letter after the news conference. I know if I provided it now, none of you would pay attention to anything else that we would be saying. You'd be reading the letter. But each week, as we have now held 159 press briefings, I always begin the week by telling you what our goals are for the week, and I will continue to do that. The number one goal that we have is to slow the spread of the dangerous Delta variant in our community by taking every to make sure our testing sites continue to operate 7 days a week in addition to our one-stop vaccination site. Number 3, to remind our residents we are starting the flu season and the importance of getting their flu shots. We do have a medically qualified physician here today. The Orange County Medical Director, Dr. Christian Zuver, is here, who will give a brief update momentarily. And the fourth goal for this week is to encourage residents to participate in the ongoing Orange County redistricting process. So, let me give you the numbers, the most recent numbers that have been provided to us by the Department of Health. There are now 225,988 coronavirus cases reported in Orange County, so nearly 226,000 cases within our county alone. The number of Orange County residents who have died from COVID-19 has reached 1,968, which means that we are very quickly approaching 2,000 deaths in our county. The number of deaths have increased by 46 since we last reported to you on Thursday, September the 23rd. The 14-day positivity rate is at 9.31%, below double digits. This is the first time in a while that we have been below double digits. Again, the goal that we have is to get that number at 5% or less. I believe that with the tremendous efforts that are underway to increase the rate of vaccination in our community has contributed to that decline. The percentage of residents aged 12 and older who have received at least one dose of the vaccine is 73%. As many of you know, last week the CDC announced the Pfizer booster shot would be available to a number of different groups, including those aged 65 and older and to those ages 50 to 64 with underlying medical conditions after at least 6 months from receiving their full vaccine series. Today, we can announce the Pfizer booster shot will be available starting tomorrow at our Camping World Stadium vaccine site. You can also get your free first or second dose of either the Pfizer or Moderna vaccines at Camping World Stadium as well. The vaccine site is available 7 days a week between the hours of 9 a.m. to 5 p.m. Over the weekend at our 3 testing sites, our Orange County Health Services administered a total of 2,665 tests. Free COVID-19 testing is available at 3 locations in Orange County. They are Barnett Park and the former Claricona Elementary School, which are open between the hours of 9 a.m. to 5 p.m. And the Econ Soccer Complex, which is open between 9 and 4. As we always tell you, you can get information by going to ocfl.net/testing for information on testing sites and ocfl.net/vaccines for details about our vaccine opportunities. Our county employee vaccination numbers will continue to be updated, but the latest numbers that I have, as of Friday, 85% of all Orange County employees have had 1 or more shots or were granted accommodations. That includes 94% of non-union employees and 69% of union employees. The I Got My Shot vaccination trailer is out and about today. This week it will be at the Goodwill locations throughout Orange County. Today until 2 p.m. it will be at the Goodwill on South Orange Blossom Trail. Tomorrow morning it will be at the Goodwill in Apopka on East Cimarron Boulevard. On Wednesday morning the trailer will be located at the Goodwill on Curry Ford Road. And then on Thursday morning the mobile vaccine site will travel to Goodwill on South Goldenrod. The pandemic has impacted many of our residents and their ability to pay rent. I want to continue to urge residents to apply for the rental assistance. You can go to our website to get information there as well, ocfl.net/rental assistance. And to date, more than 1,663 families have qualified for the rental assistance, and $9.3 million have been approved for distribution. And just to talk a little bit more about the redistricting, our second Orange County redistricting meeting will be held here in the administration building tonight At 6:30 p.m., we encourage our residents to take part in this important process that only takes place every 10 years. There are several ways to stay involved as we go through the process. One is you can attend the meetings in person. You can watch the meetings on Orange TV and our Orange County social media channels, and you can also submit a public comment online through our website at ocfl.net/redistricting. The same website has the full schedule of meetings and much more information about this process. We also received some good news from the state. This past Friday, we were granted more than $41 million in state funding to go towards septic to sewer projects in 2 of our districts. The bulk of the award money will go towards the septic to sewer program in the Wekiva Springs area, and the rest will go to the Pine Hills area. These funds are part of the wastewater treatment grants that will help improve the water quality across the state. Before I go to Dr. Pino, I just want to also, we'll open it up in just a few moments. Our medical director, again, Dr. Christian Zuber, is here, will be speaking momentarily. We also have our public safety director, Mr. Danny Banks, our county attorney, Mr. Jeff Newton. We have our director of health services, Dr. Yolanda Martinez, our HR director, Mr. Ricardo Day, and I believe from the school district that Ms. Babinski arrived. Okay, perhaps she has not arrived yet. And then we're joined by Orange County Commissioners Maribel Gomez-Cordero and Commissioner Nicole Wilson. If there are any questions that need to be translated in Spanish, we have my special assistant, Ms. Ilia Torres, who will do that for us. And so with that, I'm going to open it up now to toss it to Dr. Pino. Dr. Pino.
Thank you, sir. Good morning, everyone. So the question is where we are in the pandemic today in our county, and we are getting into a very good position. And I know some of the data, especially death data, doesn't feel that way, but this is something that was predictable, expectable, and the numbers are within the range that we were expecting at this point. We probably will have maybe 3 or 4 more weeks of higher death rate following the wave of Delta variant that we have 3 to 4 weeks ago when it started, but the numbers are definitely decreasing. Just to give you a quick recap, the mentioned to you that we are at 225,988 cases for the pandemic in our county, and our rolling average is a 9.3 positivity rate, which is the lowest we have in a few weeks. Remember, we were in the 20s, and that's an indication of where the pandemic is going. Also, to that effect, our incidence rate, how many cases we have per 100,000, went from 641 per 100,000 that we had at the highest of this wave to right now 157 cases per 100,000. Also, another good indication of the data, although Sundays are not the best day, but still yesterday we only have 249 cases reported to our county, and last week was the week with the highest decrease ever during this pandemic, from one week to the next. So the decrease has been of about 40% in the number of cases from week 37 to week 38. With regard to the number of deaths, that's one data point that continue to still point in the wrong direction. As the mayor mentioned to you, August has right now a total of number of deaths of 405, and September so far 119, which is a large number for September. But September is almost ending in this week, so it's going to end very low respect when you compare to the prior month. So the total number of deaths is 1,968. The range is 29 to 107 years old. We need to verify that data from the 107. We have 40 additional deaths reported to you since we talked to you last. 16 female, 30 male, 12 Hispanic, 34 non-Hispanic, 11 black, 30 white, and 5 of other. We have 23 with known underlying conditions and 23 also that we don't know at this point. 4 of the deaths are from August and 42 are from September. Of the 4 of the 46 deaths, were in assisted living facilities, or at least the resident has an address to an assisted living facility. 5, or 10.9, were fully vaccinated, with a median age of 79 for those who were fully vaccinated that died. And 2 of the 46, 4.3, were partially vaccinated with 1 dose of a 2-dose series. 1 person was past due their 2nd dose, and 1 person was not past due their 2nd dose. For the variants, Delta continued to be the predominant variant, and other reiterations of Delta variant. And for vaccinations, as the mayor mentioned to you, we have reached 73% among all of our residents who are eligible for the vaccine with at least 1 dose. And for series completed, it's at 63%, which is also very good. The mayor also mentioned to you that the mobile shot, starting this week, starting today, is going to be rolling again through our county. It's quite popular, so we will start coordinating those events. And also today, we will not be testing in schools. We are going to pause that. The reason to pause that, it has several layers. First, the number of cases has reduced significantly, and the number of people who are showing up to the schools to do testing has reduced significantly. Also, the testing in the schools was mainly intended for those who needed to go back after the 4 days, and that was also eliminated with the new emergency order by the Department of Health, so that the parents have the discretion of the quarantine of the child, so that test, that's negative test at the 4th day is not needed anymore. So that's probably part of the decrease in the demand. And for that, we are reallocating the resources and moving into vaccination. It is important to get vaccinated from now to the end of the year. We have several holidays coming, and we know what happened with holidays, although we will not be in that position because our highest percentage of vaccination that we have achieved, but still, we need to protect as many people as we can. And also, very soon, students will be eligible for vaccine younger than 12, and we encourage parents to vaccinate your child as soon as the vaccine becomes available. With this, I will transfer the microphone to Dr. Zuber, who is the medical director for the Department of Health Services.
Good morning, thank you. I will just echo briefly the importance to keep the message for vaccinating for COVID-19 out there in the public. You know, we've seen a lot of improvement in our numbers, and that's due in a great part to the efforts to have people vaccinated and our social distancing and masking. But for the first time in probably a couple of years, we've been so focused on COVID. I have to remind people about influenza. Influenza season is upon us now. We have not dealt with, I think, as much of a burden of influenza locally over the past couple of years. COVID, of course, has been our overwhelming focus, as well as, with the social distancing and the masking, we've seen what appears to be really good decreases in influenza seasonally. Concerns are that with people using masks less often, people gathering more, that we are in a position this year to potentially have a problem with influenza and we don't want to find ourselves in the position of fighting a dual pandemic, where we're still fighting the COVID pandemic, and then we have to really get behind and fight influenza. Influenza is still a really serious illness worldwide. It often affects folks at both the younger and the older spectrums of our population. And with that as the primer, I just really want to reinforce the importance of vaccine, The flu vaccine is available. It's effective. And I would encourage everyone who's eligible to really look towards the flu vaccine. You can be co-vaccinated. It's important to be vaccinated for both COVID as well as influenza. And now is the time to really start looking at increasing our focus on influenza as well. So we can hopefully, as we get into the holidays, when we have gatherings and congregating with our family and friends, that we don't have that added burden of influenza. So please, physicians' offices, pharmacies, your healthcare providers, please consider your influenza vaccine this year. It's really important because of all the serious concerns with influenza and concomitantly with COVID. The other benefit of that will also help decrease the burden on our emergency departments and our healthcare system, with patients presenting with both symptoms that look very similar between COVID and influenza. And vaccination is probably our best opportunity to prevent ourselves from getting into a situation like we were in previously this summer, where we had a big rise in COVID, and we will expect numbers to fluctuate. So please encourage influenza vaccine for everyone out there who's eligible. And with that, I'll turn it back to the mayor.
All right, thank you, Dr. Zuber. At this time, we're opening up for any questions that you may have, and as we customarily do, there will be a microphone that will be moving around, so we will have an orderly process.
Mayor Demings, Lauren Cervantes with News 6. What are the fines associated as stated in the letter, and how does the county come into compliance if people have already gotten the vaccine because of the mandatory requirement?
Under the presumed law, the fine would be $5,000 per incident. So the letter did not establish what the fines would be. They requested some information from the county, and at some point we will provide the information, but there's no doubt we're going to end up in litigation regarding this.
And then the follow-up, how is it possible to come into compliance if people have already gotten the vaccine? How many retroactive kids are going away?
I think that's to be determined. That's something that will be determined through the process. That's something that will ultimately be determined through the courts, I believe.
Mayor, Greg Fox, West TV. Do you believe that since your decision Thursday was followed less than 24 hours later with this letter, do you believe that the governor himself directed the Department of Health to send that as a punitive action, since they could no longer punish you for firing somebody?
I think that it will be mere conjecture on my part, but clearly this has some political overtones. And if I were a resident of Orange County, I'd be really concerned that somehow, the state, the governor, would try to punish Orange County in any way. After all, the fines will be paid by the county, taxpayer dollars. They wouldn't be paid by me, so this isn't about me necessarily. But as the mayor of the county, the CEO of the county, I'm responsible for all county operations, and while we're fighting through this pandemic, my goal is to keep our citizens safe. When we look at historically, better than 10% of our county employees over time have tested positive for the coronavirus. The overwhelming majority of our employees who have tested positive are, I'm going to say, those who are in public safety. Our firefighters and our corrections officers represent the greatest number of our employees who have tested positive. And Director Banks can probably give you the numbers historically, but I believe we've had some 391 of our firefighters who have tested positive over time. If you look just within the fire service, the certified firefighters, that represents nearly a third of all of our firefighters have tested positive. When we look at corrections, I believe the number is 438. That's probably a fourth of our correctional officers. And within corrections, sadly, I have reported to you over time that we've had 3 corrections officers who have died of COVID-19. So in a community where we're approaching 226,000 individuals who have tested positive, my job is to try to look broadly and put policies and procedures in place that will not only protect our citizens, but protect our employees. And so I believe that we're on solid ground to make the decisions that we have made. Since the mandate has been put in place, we've seen a significant increase in the number of our employees who at this point have attested that they have completed the vaccine series or received at least 1 dose of the vaccine. So in my mind, the mandate is one of the precipitating reasons why we have seen an increase in those numbers. Director Banks, if I didn't get those numbers quite right, you know, he may have them. Did I get the numbers? Okay. So that's where we are. So hopefully that makes sense to you, what I just said to you, why we have taken decisive action in this county to protect our employees who have to go out and serve in this community. And you've heard me say that with our firefighters, these are EMTs. Every firefighter we have is an emergency medical technician. Many of them are also paramedics. That means that they are directly involved in the delivery of health-related services here within Orange County. And I think that as an employer, we would be derelict in our duties if our firefighters, as they respond to take care of the citizens, are also infecting the citizens because of their refusal to get vaccinated or what have you, or take appropriate precautions. Every day in the American society, the government has certain mandates that it puts in place to keep all of us safe. Every one of us mandated, if you're in an automobile and you're driving an automobile, to do what? To wear a seatbelt, because that protects the greater good of all of us in the process. And I can tell you that when I look at our fire service and firefighters, law enforcement officers, I spent a full career, nearly 4 decades as a first responder. And there were times that in my career I responded to the clarion call to assist someone who wanted to end their own life. They were trying to commit suicide. But we intervened in the process and to protect them, because that's what we're supposed to do, because they had made poor decisions. I can tell you that firefighters every day in this nation respond to calls for service where individuals, again, threaten to commit suicide. They make a poor decision. But as they respond to treat that patient and they transport that patient, they try to save that patient's life. Every doctor, every nurse does that when someone who has tried to kill themselves ends up in an ER room. These medical professionals try to save their life. So it's no different in this pandemic. As the death toll continues to rise, the rate of transmission continues, you ought to understand that that is the fundamental role of government sometimes, to intervene even when individuals may not deem that that's the appropriate thing in the best interest of their life. But what we've tried to do here is the firefighters, for example, said they wanted a choice. We've given them a choice at this point. Your job isn't in jeopardy, but if you don't do it, you're going to get a written reprimand. We've given them that choice where they don't have to get vaccinated. But we're going to subject them to, every time they report to a shift, they're going to be tested. Again, why are we doing that? To protect the public. to make certain that we are not inadvertently further endangering our community for the remainder of this healthcare crisis that we all living through. So, long way to answer your question, but I believe with full transparency and clarity, and I wanted to the members of our public to hear the rationale why I have made certain decisions in this case. Okay. Other questions?
Yeah, Dr. Pino, Asher Wildman, Channel 13. We've been trying to get this data for a few days now from Department of Health Orange County. When Governor DeSantis said that roughly 98% of students that are sent home to quarantine do not test positive for COVID. Are you guys tracking, it's two-part, one, of how many students are being sent home to quarantine, how many of those students are testing positive, and two, are we reflecting the 98% that Governor DeSantis says are going home healthy?
Well, I'm pretty sure the governor was talking about the state data in general. I don't have facts